Welcome to the Understanding Access to Care Calculations and Methods meetup. I'm Megan Martinez, an industry marketing specialist here at Esri and Redlands, and I will be your moderator today. This webinar is being recorded, and you will receive a follow-up email with a link to the recording in the next few days. Before we get started, I would like to encourage you all to post your questions in the GoToWebinar questions dialog box throughout the presentation, and we will answer as many questions as time permits after the webinar. Now I'd like to introduce our presenter today, Jared Schultz. Jared is the Health Technical Specialist and Lead Solutions Engineer here at Redlands, and he is also based out of our Redlands office. So now I'll hand it over to Jared.
Thanks, Megan. All right, so I want to continue this great progress we've been having on our meetups and get into understanding access to care, calculations, and methods. All right, so the purpose of this meetup is to show you, and I'll click through some of the steps. A lot of times I'll just show you the results of the analysis, how to use ArcGIS Pro, the Network Analyst extension, StreetMap Premium, Esri Demographics, and Web App Builder, and using an overall WebGIS approach that leverages either ArcGIS Online or ArcGIS Enterprise portals, and how that can be used to measure and understand overall network adequacy. I'll walk through a 5-step process that'll help address and understand access to care components, understand these populations with barriers to needed services, detect and fill gaps, as well as help organizations improve delivery of healthcare to meet both regulatory requirements, improve outcomes, and increase patient satisfaction. So why is this important? There's a lot of different regulatory requirements out there, either for the center from CMS or from state agencies. They're broken down by provider and facility specialty types, as well as based on different type of urban density and population density areas. There's quantitative standards that are out there on contracting with different providers and having providers in network and both time and distance requirements. And then just in general, healthcare organizations want to, have good access to care programs and services to get upstream for preventative care and address emergent issues in a timely manner. And of course, there's the whole desire for the universal health coverage and the sustainable development goals that are out there, and the fact that over half of the world's population lacks access to essential health services, and this has huge impacts on other aspects of communities and societies. So what are we talking about measuring when we talk about access to care? As I mentioned, there's standards coming from NCQA and CMS and individual standards from state, departments of healthcare and insurance agencies. And most of them are pretty similar. There's some slight variations on them, but these tools that I'm going to show you allow you to walk through and address any of the needs. And the results, one of the results of going through this process is being able to meet reporting guidelines on network adequacy, showing, by provider type, by practice type, how many members are meeting a standard, whether that's a 10-minute drive time or a 30-minute, 30-mile distance. So there's all sorts of different ways to look at this in reports, but we're going to walk through a basic workflow. And there's a lot of other dimensions to access of care and network adequacy. It's not just about how close the facilities are, it's about what types of services the facilities offer, whether or not it's affordable, what type of insurance they're getting, what the population that needs to access those facilities, whether or not they have access to different forms of transit. So there's a lot of things looking at whether or not supply matches with demands and different variables that you can look at when you're looking at accessibility. I'm going to walk through a demo, but I'm also going to provide some case studies where people have looked at this different ways. And by understanding this, you can prioritize your improvement efforts. You can target where you have specific populations with barriers to access, what areas there's disparities, and what locations will have the most impact either on particular conditions or populations of interest. Well, who cares about this information? Who is responsible for this? There's a lot of different aspects of healthcare organizations that have a vested interest in ensuring that there's proper network adequacy. You've got health plans that are out there ensuring the network provides adequate service coverage. Providers that want to make sure that they can have appropriate and timely access to care, avoid complications and hospitalizations by having easy access to services for individuals to come to for both preventive measures and emergent measures. And then public health has long been interested in ensuring the optimal distribution of public health services. A lot of organizations are conducting things like certificates of need and doing all overall accessibility, permitting, and regulating these facilities. And this can be a big problem, a big task for a lot of different organizations when you start looking at the different variables that you have to consider. Here's an example where a particular organization was looking at its providers and its members. 350 providers per specialty, 40 specialties, 2 lines of business, ends up with 28,000 different provider locations. When you consider that there's 1.2 members, when you start looking at all the possible permutations about, the calculations when you're looking at access to care, the number starts to get very large. In this particular example, we're talking about 33 billion different calculations. I'm going to walk through a 5-step workflow where I'm going to look at getting data ready, getting access to your data from different sources, making that data GIS ready, performing analysis, interpreting the results, and then sharing this information with others. And also going to add another step in there on how to optimize your network and evaluate, adding different facilities. So when I say get your data ready, what I'm talking about is grabbing your member and your provider data from whatever format and whatever system it's coming from, whether it's your if it's a Medicaid management system, a claims and billing system, electronic health record, and admission systems, wherever you can get access to your member data as well as your provider data, the number of both facilities and specific healthcare professionals that are providing services to the population of interest. There's a lot of different places to get provider information. There's the NPI registry, there's the state medical boards, state Medicaid agencies. So, you've got to bring your data to this type of analysis in order for it to work. We're going to make that data GIS ready. We're going to geocode, show an example of geocoding some of these members and providers using ArcGIS Pro, Network Analyst, and StreetMap Premium. We're going to take those tabular data and then visualize it on a map. We're going to walk through the process of preparing an analysis layer for an origin destination analysis, which looks at every one of the facilities and finds times and distances between the points, calculates some averages, and select members who meet the standards. We're going to be able to share that information out to a web-based application. We're going to use ArcGIS Online. You could also be using Portal for ArcGIS, and we're going to configure a quick application using Web App Builder. We're going to do a few other things in desktop to get that ready, which is making some drive time polygons and aggregating data to different geographic units to protect the underlying confidentiality of the patients, but expose the information enough that other parts of your organization can work with it. And then we're going to walk through some iterative analysis looking at the best place to put a facility. So now I'm going to go ahead and switch over to this demonstration, and we're going to start off with ArcGIS Pro. And I've got a project here where I've completed all of these steps, but I'm going to walk through and show you how to get through a few of the steps using ArcGIS as kind of a system of record to take that information, catalog it, and start working with it. So first of all, I want to go ahead here and I want to add a locator. So let's go ahead here and insert and connections, and I want to add a new locator in here. You can see I have a number of different options once I explore to my data source. So I'm going here to StreetMap Premium, the most current version of StreetMap Premium, the 2018 here data, and I'm going to select my USA composite locator. So now I have access to the underlying street networks that I can use to geocode all of my data. And this is using individual address points, street segments that have been segmented out with different address ranges so that I can get the most accurate depiction of where my individual points of data are at. So now I want to go ahead and geocode some data. So I'm going to access my analysis, go to my tools, and geocode. Geocode addresses. I can right click on the individual layers also and run through some wizards to do the same thing. There's a lot of different ways in ArcGIS Pro to accomplish the same task, but I'm going to walk through using this method here. So let's go here, and I'm going to grab one of my input layers. Let's do my provider data set where I've got a little bit of additional information in there. And now that I've added my locator, I can see it. Since I'm looking at mapping out providers right now, I could use the ArcGIS Online World geocoding service. If I was mapping my patients out, of course, I want to keep that geocoding local. So I'm just going to go ahead and do all this locally, and I'm going to use the USA composite service from StreetMap Premium. And then I specify my output feature class here, and we'll just call this result 2. And then I just set up my address locator here. Address goes to address, city, county, state. It all automatically mapped, but I want to go ahead and map across to my zip code. And then I go ahead and geocode that information. I don't want to wait for the time to go through and geocode all of these different 200 plus providers right now. So I went ahead and have those providers ready to go. All right, so now I've got my providers on a map here. That was my first step of understanding what's going on. And if I look at my provider layer to see what I actually have in there now, you see I've got the address information as well as other information on the type of provider it is, as well as some information on, based on the CMS guidance, on the county that it's located in, what the county designation is, which is field 11 here, which is large, metro, or micro, which then indicates or then depicts what my both time and distance requirements are for those individual providers. So I've got all that information. The next thing that I wanted to do was go ahead and look at my, my members or my patients. I've got that information right over here. I can drag it across on my map. And now I've got both my providers and my members, which are the primary inputs I need in order to run the subsequent analysis that I'm going to go through here. All right, so next thing we want to do is change this base map here a little bit so that we can see some of our data a little bit better and get rid of the background street, which is a little bit distracting right now. So let's just go to more kind of washed out base map. We'll use our light gray here. So I still have all the context I need, but it's not quite so distracting. Okay, so I want to create an analysis later. I want to do some calculations that looks at every single one of these members to every one of the providers and picks maybe the closest 3. So in order to do that, I'm going to go to analysis, go back to my geoprocessing tool, and let's go cost matrix. And I want to make an OD cost matrix analysis layer. There's other tools that you can use to find closest facilities and calculate service areas, but the OD cost matrix analysis process runs you through the complete steps that you need, so it's a very efficient tool to use. Now I'm going to grab my network data source, and again you can see that I'm using StreetMap Premium here as my data source with routing capabilities enabled. So I'm going to go ahead and do that. And then I can just do any type of output layer name that I want. We'll call it 6. And then I start running through and setting up my individual parameters. I could do drive time or drive distance analysis. And when you're looking at calculating your network adequacy, you want to base it based on what is the most restrictive variable possible, either driving time or driving distance, to make sure that you adhere to the regulatory requirements and standards. I'm just going to do drive distance on this one, but you can see I have rural drive time, trucking time, walking time, and distance for all of them. So there's a lot of different options on what you can do. I can set off some cutoffs. I'm going to leave this here, number of destinations to find, which will determine how many different providers you're going to find. You're just going to find the closest facility, or you're going to cut off at a certain distance or time. I'm just going to go ahead and say I want to find maybe the 3 closest providers here. Again, the nice thing about these tools is they're completely configurable, so that regardless of what your regulatory requirements are, it's flexible enough to adhere to those. All right, so then let's go ahead here. I've got a number of different options where I could actually do my network analysis based on the time of the day. I'm not going to do that. Select my output geometry. I'm going to select straight lines here, which means that for the distance analysis that's done, it's not going to generate the actual network distance along all the streets that somebody needs to get from their home to a facility, but it's going to generate some straight line output that'll allow the tool to run a little bit faster. And then I can visualize, it's kind of like desire lines, or a spider diagram is something that's very commonly called in the GIS world. So I'm going to click straight lines, and then I want to accumulate some different attributes here. I'm going to use miles and minutes. So as it's going ahead and calculating the distances, it's going to accumulate that information and add it to my attribute table so that I have it there. So basically, I'm setting up my framework for my analysis. And if I go ahead and click run here, it's going to create a new layer over here, which is an OD cost matrix 6. We'll let that run while we walk through a few other things here. It's going to generate, just like I have here from the last time I ran it, a cost matrix layer, and go ahead and turn all that underlying inputs on. I have this other one available here because I'm not going to run through all the steps because it would take too long, but I'm going to walk through them right now very quickly to just show you the results. All right, so next thing I want to do, you can see when I'm on this layer, I'm using ArcGIS Pro, which is context sensitive, which means whatever layer that you're on or whatever feature you're on inside of the application, it exposes all the tools that are most appropriate for that particular data set. So here I'm going to click over to my OD cost matrix, and I want to go ahead and load up all the underlying information in here. So let's go ahead and import my origins. In here, I would grab my origins, which are my members, and then I would load those in. And once you load those in, it looks like that. The next thing I want to do is import my destinations, and my destinations are the providers where they're going to, and I've already got those loaded in here also. And it just does this kind of standard color rendering just because it's a step in the analysis. So it doesn't look very cartographically pleasing, but it has all the information that you need. All right, so now I want to go ahead and do my next steps here, which is set all my other parameters here. So I want to do driving distance as I had set up before, but I see that it's set up as kilometers, and I'm not measuring anything in kilometers here. So I want to go ahead and modify that a little bit. And you can, with ArcGIS Pro, a lot of times what you have is when you need to go deeper into the settings, and you just click on the little option here, and then you have all sorts of different things. I want to go with my cost, and I'm going to say that my cost is going to be miles. Travel time, we'll stick with minutes, and you can see that's modified there. And then I'm going to go ahead and accept, if I'm going to do a cutoff, I'm not going to set up a cutoff again. That was the same thing we did before, either distance or time. Now I'm going to do the three closest destinations. And then here I have the same options that I had before, where I could use traffic for today, real-time traffic that's been feeded in, or I could do based on the day of week or different times and get my output layer here. And I've got all my different options that I can set up, and I went ahead and ran that already. So let's go ahead here and look at the results. The results of that analysis is these lines that go ahead from each one of my providers to each one of my members. And here, if we explore this a little bit more, let's go ahead and pull this information up in my lines layer here, which is my result. All right, so now I can see in my line table. Oh, I forgot, I gotta click on the other one. So if I go in here to my lines table where I already ran that analysis, I can start to see some pretty interesting information that's going to feed into the subsequent steps of my analysis. I can see for every one of my 200 plus locations and every one of my providers or every one of my members, which is about 4,500 members that were done in this particular demonstration here, I can see the closest 3 providers to each one of those. And I give you a destination rank for them here. And then I can start looking at, what the total minutes and the total miles that individuals need to go from from their homes to each one of my provider locations to get to basically to the closest 3. But that is providing a table with over 13,000 rows in it with all the possible combinations. But what I want to do now is go ahead and dive into this to do some reporting statistics where I can start look at each one of those and summarize them based on kind of the guidelines that I'm being evaluated on. So if I right click on my lines layer here, and I want to do a join, and I want to do a spatial join. And what I'm going to do here is take my target of lines and I'm going to join it back with my underlying provider data set that had all the information on what the access requirements and regulations were. So let's go here and just grab one of my provider data sets. And then it's going to go ahead and do a spatial join. And I can name it anything that's unique here. We'll go ahead and increment this up since I've done this a few times here. And then we need to do one to many. And targets, lines, join features, okay. And then we can go ahead and run that analysis, which I've already done here. So let's go ahead and look at the results. All right, so what I've got here now is the information on all of my providers. I've got those lines there, but now it's linking back to each one of the requirements that I had put together based on the guidance on the location of the provider, what county it was in. So I can quickly see information on what the primary care time and distance requirement, the cardiology time and distance requirement was for each one of these. But still what I have here is all of this information for all the different possible destinations, the 3 destinations that I ran here. But I want to kind of summarize that information down to get right at my reporting metrics that I'm being engaged on. So in order to do that, I'm going to go back in here, and I can actually click anywhere in here, click on any one of my columns, and just do some summary statistics. And then I can go ahead and set any one of my options here. So my input table is the results of my join in my OD cost matrix analysis. And then we'll do some output here, just increment it up a little bit. But what I want to do is, organize my results, based on the provider type, the requirements based on the geography in a way that I can pull out the reports that I need. So for here, I'm going to go ahead and my line spatial join, I've got an output. My fields I want to look at. I want to look at total miles. I want to do a mean there. total minutes, mean, and then I'm going to look at my specialty provider. So I'm going to let's do cardiology time, cardiology distance, and then we'll also do one more. Maybe we'll do primary care provider time and distance. And I want all those to be my means. And then I want to also not only determine those overall summaries for those provider types there, I want to go ahead and look at them based on the destination rank, the first closest facility, the second, the third, as well as the specialties. So I'm going to go ahead here and look at destination rank. And I want to also do provider specialty. And then I want to do county designation here, which I've actually got this one. I didn't put a field alias on this one, so this is actually my field 11 here. And then I can go ahead and run that project or those steps. And what I end up with is some summary statistics, which are exactly what I need in order to report up based on different requirements that are out there. Let's go ahead and look at that. So now I can see my results here. So I can see for the closest cardiologist in this member provider network here in a large metro designation area. I've also calculated for a metro and a micro area. I can see how many facilities I have in each one of those areas. I can see what the mean or the average miles are here, as well as minutes. And then I can see that I'm adhering to my standards for those based on the provider type here, because I've included them across the board. But that information there is not exactly in the format that I need in order to produce my reports. It's got all the required data, but I need to be able to go in and select by my facilities and look at or select by my providers and my results to see exactly how many of them and where they're located at that are meeting the guidance or the requirements. So I'm going to go in here and I'm going to use my lines layer. And then I want to go ahead and do my, let's see here. I'm going to select by attributes. All right, and I want to add some clauses here on my lines. I'm going to create a new selection, and I'm going to query that data. I want to look at where destination rank is equal to 1 and add that. I want to find where, let's go ahead and add a new one here, which is where total minutes is less than, and then we'll do 30. And here is where you can adhere to whatever types of requirements you're trying to put in place. And one more. Total, let's do total miles is less than 10. All right. And so now when I go ahead and run this, essentially what it's doing is it's going in on the entire results of that analysis. And if you think about doing that on the results of larger types of analysis, is really processing a lot of data very quickly. And if I go ahead and pull this information up, and just pull in my selected, you could see that 4,321, and I can just highlight those selected patients in the closest provider facility there are meeting the overall requirements, which is within the threshold that I've set based on the 10 miles and 30-minute drive time. And then is all I need to do to get that into that reporting requirement where I look at my overall number of patients that are adhering to my standards is I'm comparing that with my total number of patients, which there's 4,457 in this analysis. So if I divide, 4,321 by my total number of patients, I can quickly see that 96.9% of my patients are meeting this requirement for a particular, provider type. So it's a very simple and easy process to walk through. And conversely, I know how many people aren't meeting it, but I want to go ahead and actually look and focus in on those facilities or those patients that aren't meeting that requirement, because that's going to mean a lot of different things to my organization. Either I need to, contract with another individual here, in another provider in that location to fill the gap, expand my network, or looking at providing additional services for certain provider locations to, maybe provide OBGYN services or cardiology or other types of services to shore up my network. All right, so let's go ahead and look at that a little bit more. So I want to go ahead and execute a few more steps to be able to look at that. So I'm going to go back here, and I've got another map that I've set up here. So I've got my providers and my members. But what I really wanted to do was to be able to find the number of providers that aren't, or the number of members that aren't within a certain distance of my existing providers here. All right, so we've got our providers and members in here, and let's walk through this analysis. I want to go ahead and I want to make a service area analysis here. So if I go here to service area, I'm going to do the same thing. So one nice thing about Pro is it's really easy to locate things just by using the search function. Searches across the entire board in Pro, which makes it easy to find the resources and even link back to more detailed information on the tools. So I'm going to go ahead and generate some service areas here. I've got all sorts of different layers for my facilities. I'm going to use my providers, and then I can set up my cut point values here. I set up my environments and everything else that I want. I'm actually right now linked across to the tool that's running as a ready-to-use service. So rather than doing the analysis using like StreetMap Premium and Network Analyst on your desktop, you have the option to also do this analysis using ready-to-use services from ArcGIS Online. Well, the process of going through and setting up your service area analysis layer is very similar to the OD cost matrix. So I'm just going to kind of walk through the results here rather than click through each one of them. So I'm adding my facilities and my polygons and generating my service areas. So I generated my 5-mile service areas around each one of these facilities here. And then what I want to do is to be able to go in and then reverse that analysis. I want to be able to see, let's turn off some of this other data so we can see what's going on here. And just looking at my providers and my network. And you can start looking at the 5-mile service area around the providers. And immediately you can start to see your members that are in that 3, 4, 5% that wasn't covered from the existing 5-mile service area, 10-mile service area, your drive time analysis. So I was going to go through a process here where I generate some hexagonal bends. So I'm going to do some hex bends using our tessellation tools, and then I want to go ahead and aggregate all of my these patients that aren't covered by existing service area into some hexagonal bends that I can share out. So I went ahead and did that step. Let's go ahead and turn all this other data off. And now what you can see here is hexagonal grids that are then showing the information. If I go ahead and click on one of these, shows exactly how many patients. I've got 10 patients in this area that aren't covered by an existing service area. And say that I want to understand a little bit more about what's going on in that community. Since ArcGIS Pro is directly linked to all these services and data that's available through the Esri platform, I'm going to run a quick infographic here on this area where I have the least amount of coverage. What is the underlying population here look like that I'm not completely serving with my current network? So I can see some breakdown information on education levels, median household income. I can see things like comparing that to, the county that it's located in and other counties in the area. I can even look at maybe some health insurance coverage and statistical information here. Go ahead and pull that up. And that's all based on that area that I'm looking at right now, which is a really fine area. I actually, when I generated my grids, I used 1 square mile area. So all of this data is being apportioned to that area. So now I've got a lot of information here, but what I really want to do is share that information off with my provider recruitment group and other parts of my organization that probably aren't using desktop GIS tools. They're really more interested in web-based tools, simple applications that they can use because they don't have a very strong GIS background. So I'm going to go ahead and push the results of my analysis out. Both those coverage areas here or my service areas around my facilities is where I have patients that aren't covered. So in order to do that, I've got a little layer, another version of the map here. I just duplicated my map and set up everything how I wanted. I can quickly go here and once I do this, I have the options to share this out. I'm going to go up to my share option. I'm going to share this as a web map. And then I have all sorts of different configurations. By default, when I share this information out, it's not going to be shared with anybody in my organization. I got to constantly share that out. I can share it out with any of my individual groups, set up different tags and configuration types and everything else. For the sake of time, I've already got that done. So let's go ahead and look over in my portal. And you can see I have that exact same map that was included before. But now it's shared out in this example, I'm using ArcGIS Online. It could be ArcGIS Enterprise, your enterprise internal portal also. And I've got all the information from desktop, my 5-mile service areas, my member aggregates. But what I want to do is create a quick and easy tool for people to go ahead and explore. Maybe I'm going to place a new facility here, place a new facility there. What is going to be the overall impact? What I really want to do is increase coverage in these areas that not only aren't covered by an existing service area, but that also have a large number of patients. So I really want to get the most bang for my buck if I'm adding new providers into my network, or really expanding what's going on here. So I'm going to go here, share this out, and then I have different options here. I'm going to go ahead and create a web map. And from here, you have access to all sorts of different types of configurable web applications in the ArcGIS platform. You can do social media maps, public information maps. You can do operations dashboards. What I want to do is web app builder. And so let's call this provider 5 miles. We'll just call it app. And then I'm not going to enter. I'm going to break every rule by not providing all the information in here for people to locate this. But for the sake of time, I just want to get through this, and let's go ahead and get started. So I took that results of that desktop analysis, published it out to my portal, opened it up, and then shared it out to a configurable app in just a few steps here. So now I've got Web App Builder, which is an application builder that we make available through our portals that gives you access to a lot of different functionality and features here. I'm going to go ahead and add some widgets in here. So let's go widget 1. And I want to add a draw widget. So let's grab that and OK. And then I want to go ahead and check my option here to add the drawing as an operational layer of the map, and you'll understand why that is in just a moment. Next thing I want to do is go ahead and add an analysis layer. I actually want to expose analysis capabilities that are coming from my portal to folks so that they can walk through and do some type of iterative analysis here. You don't want to necessarily bottleneck all of your spatial analysis down, to one individual person in your organization, because a lot of people want to explore data. There's a lot of expertise across your organization and insight. So you want to kind of expose these tools to folks that have the expertise they need to be able to explore this data and look at it. Just kind of like, everybody in your organization has access to, Excel to do, tabular analysis, or maybe to PowerPoint to create PowerPoints, where you want to give people access to the tools they need to run some analysis here. So I'm going to go ahead and do my drive time areas and click OK. And then I want to add one more widget here, which is kind of a result. It's a situational analysis, situational awareness tool. All right. And then inside of the situational awareness tool, I go ahead here and add tabs. And then I start mapping out what I want to do here. I want to look at my member aggregate data. And I want to do a summary of how many members are covered by these service areas that I'm going to draw through this application. And we'll just call this maybe members. Oh, can't type. Members. And then I can go ahead and set all sorts of different options here and then preview this application. I went ahead and did that right here. So you have your resulting map with all these different, or web application with all these different widgets here. So let's go ahead and see what it is exactly that we created. So let's say that I want to look at maybe adding new facilities. I want to figure out where to add facilities to fill these gaps that I've identified here. So I'm going to go ahead and hit my draw widget and get that ready. And I want to look at a particular address. There's one address that I'm considering placing a new facility at. So I go ahead here, have that location. I want to drop a point on there. So now that adding that as an operational layer is going to give me access to that. I want to do one more. I want to evaluate two different facilities. So let's go here. And I'm going to do the same thing, drop in a point. All right. So now I've got two different potential facilities. Let's zoom out here a little bit so we can see them both. All right. So there's the two different facilities that I added in here. So I want to go ahead now and run that analysis tool that I put together. So let's go ahead and drop my draw widget here, and then look at my analysis tool. Actually, I need the analysis tool there. Okay, so let's get rid of that so you can see it. Okay, so I want to use those 2 points because I added those as layers here. And I want to run a quick analysis on here. And let's just do a 5 mile, not rural driving distance. Let's just do regular driving distance. And there's other options that I can do here. And we'll do this as 2 since I've ran this already. And uncheck use my current map extent and run my analysis. Oh, wow, I picked a name I already had, so let's go 3. So now what this is doing is it's going in and looking at those 2 new potential facilities that I'm evaluating here, and it's going to determine how many, it's going to generate that 5 mile drive, 5 mile service area around that facility. And then I can use that as kind of my incident location, my analysis location, to then determine how many patients would now be covered inside of that area, which is kind of, my data here in my bins that was not already covered. So let's go ahead and get that to come up here. Let's take a minute. Come on. It's kind of nice to be able to use these types of tools and push these really focused analytical capabilities, because I think a lot of people have a hard time, navigating through, maybe when they're not using GIS on a regular basis, even though all the functionality exists, in desktop, in order to be able to do all of these things. It's very nice to be able to expose it for other people to be able to do it using a browser and the types of tools that they're used to using here. All right, so now I've got my two different service areas here. Now I want to click on any one of those service areas around these proposed facilities, and you can see how irregular the boundary is because there's interstates and highways and other types of access points here. So if I go ahead and click on that facility service area, set location, now what I can see is that new facility would provide coverage within that 5-mile service area to 16 new members. So I'm not getting a lot of bang for my buck there, but if I look at my other service area and set it as my location, I can see that I'm covering 164 of my members by selecting that facility to add or increase the level of service I provide at this facility. So, I've really walked through this entire process, going from just my tabular data with my providers and my members to go through a whole process to be able to calculate network adequacy, report out, as well as, determine how to fill gaps in my network. So let's go back here. All right. So here is some different examples of how different organizations have used this. A lot of these processes were put in place, based on a project that we worked on with the Inland Empire Health Plan, where they were looking at providing the closest primary care provider, to over 1 million of their members. So they worked through the same process to be able to adhere to these requirements and these standards here. And this is a case study that you can read more about if you want. Here's another example that I thought was interesting that I wanted to show y'all real quick here, which is a story map. And I'll provide the link to that is in the slides, where the same type of thing is going on here that we just went through, but they're going even one step deeper here, where they've identified and went through these steps. They've generated their points, their providers, as well as their members. They've done the distance analysis, but then they kind of wanted to dive into that a little bit more to look at impact scores. I mean, adding facilities in certain locations, subtracting facilities in certain locations is going to impact populations differently. And every area has different types of people. I mean, there's the older people, younger people in different parts of the country, different health conditions are more predominant. So this example, and this is a public-facing example that you can look at, is looking at all sorts of different determinants related to access to care. One of them is just simply the street network, the access points, even looking at multimodal transit. I mean, if it's in an urban area, you've got different forms of transit. So really considering that when you're doing your analysis. Well, the next thing here is looking at, taking that information and looking at the patients that are relatively isolated from the providers based on the transportation network. But then layering some additional information in here, like maybe estimating the potential number of visits for different members in your network based on their age, under the assumption that people in different age groups are going to be getting regular checkups on a more regular basis and getting different types of services here. So going ahead and looking at that information and then using that and overlaying it with other determinants like your household income, And combining all that information with your transportation, your estimation of visits based on your demographic, your household income, to then look at your overall impact scores. How will retooling your network, adding new providers, subtracting new providers, impact different patients across your network. And then being able to score those and giving them kind of a category ranking, which then ends up with a way to prioritize your network, looking at all your existing providers to say, hey, if this provider was removed in this particular area or they no longer operated for whatever reason, it would have a severe impact on my overall member network and even more impact on particular subsets of my member network. Here's another example from the Camden Coalition, where they were looking at where to kind of address some healthcare concerns that they had, and really they were trying to get at super utilizers in the area. So they went ahead and did some small area analysis using GIS tools, and found that most patients were coming from two particular buildings in the city. So they went ahead and they thought out of the box and placed a small primary care office directly in that building to improve overall access, resulting in a 50% reduction in claims due to the lower preventable utilization rates. There's another example where we worked with a nonprofit hospital that was looking at doing their community health needs assessment, and they wanted to look at it from a different angle. They were looking at partnering with community groups. They wanted to look at the overall accessibility to those different community groups and community organizations and really kind of support groups and projects around reducing diabetes. They were very interested in a small section of their overall member network, and it was a Hispanic population that was more at risk for diabetes. And so they ran through doing a similar type of analysis to determine what are the 10 best partners to partner up with that could best serve that community and get the message out related to diabetes awareness and prevention. And here is a more focused example around stroke, where the VA was looking specifically at stroke, and there's a big location component in stroke on how long it takes you to see a provider from the time you start exhibiting symptoms. And as it says here, time lost is brain loss, in the sense that the quicker you can administer TPA, the better off the patients are. So the VA conducted an analysis looking at the veterans that were having over 6,000 strokes a year in the VA system, and ran through doing a GIS analysis looking at historical access and utilization, and came up with some different types of approaches on how to shore up their network. At the baseline where they were at with their primary stroke facilities, they were essentially serving 18.3% of the population within a certain distance and time requirements. Well, then they looked at upgrading a particular facility and enhancing its overall capabilities, maybe going after JCO stroke certification, and how would that increase their overall capability to serve veterans use the facilities that have the training and the services that are needed. So by using one facility, they were able to increase their capacity by 36.8%. By upgrading two facilities strategically, they went up to 45.7% coverage within their target. And then another scenario similar to what we were talking about before with the community groups was establishing other types of not only upgrading facilities, but establishing partnerships in different areas that can, again, increase the overall coverage to 82.9. And then there's even other examples of looking at even more out of the box type of thinking. Here was an analysis that I did when I was with the state of South Carolina, where we were looking at the overall coverage for JCO certified stroke facilities, and kind of layering in telemedicine facilities where these remote facilities could be served, where they may not have all of the providers on site, but they could implement a telemedicine type of approach to increase the overall coverage. So there's a lot of different ways to try to get at the same type of thing. And so what you just saw here was a complete set of steps that are using a WebGIS framework, ArcGIS Pro, web app builder. I was using ArcGIS Online for this one, but it could be done in Portal for ArcGIS. Bringing in your local data. You could be linking directly to your relational database systems, pulling that data out, as well as using Esri content. I showed Tapestry, and Esri demographics, as well as our Street Map Premium data. These slides will be shared out so you guys can access them. Anybody can reach out to me if they want to have additional questions, but there's a lot of different training sources on the Esri training website where you can go through and learn how to do all these different things, from network analysis to even so specific as tools on how to create an origin destination cost matrix in Pro and finding optimal location. So any one of these keywords you can go in and search on the Esri training website. Or the Esri Academy, as we're calling it now, and access those. We've got a white paper that's available out there on 5 steps to calculating network adequacy that walks through this entire approach. And then we've also got other ways to connect and learn more about what's going on and how to do these things. We have a series of webinars that you can access from this location here that I've got on screen. We've got a number of different meetups that are available. The next one is going to be June 27th. I was going to provide a link to it, but it's not available just yet, and it will be on optimizing field operations. And we've even got a set of user seminars, the next one being April 23rd in St. Louis. And then we've got another one in April 25th. We're looking at having one in May 6th and May 9th in Denver and Houston, but we want to get those registration numbers up. So if any of you guys are geographically located in those areas, we want to have a really focused kind of user seminar that's all around help topics, with network adequacy being one of them, as well as homelessness and opioids and vector control. I highly suggest that you attend these sessions. And with that, I'll open it up to the floor for questions.
Great, thanks, Jared. We have a few questions here. The first one is, where can I find the access requirements regulation data by county?
If you search for CMS adequacy requirements, network adequacy requirements, it usually comes up pretty easy, depends on what browser you're using. And there's a whole set of materials that CMS has made available. When you start looking at, the requirements, because there's different requirements by maybe state level regulation organizations, insurance bodies, and everything else. So sometimes you got to look at your state, but CMS has these all available and posted. And if you complete the survey afterwards and ask for that information, I can send you those links directly.
Okay, and the next question here is, since the nearest location by drive time is not necessarily the nearest location by drive miles, is it a fair statement that the minutes scenario and miles scenario would be evaluated in separate cost matrix runs?
Well, usually, and that's a great question. When you're setting up your OD cost matrix, you want to, set it based on the most restrictive requirement. So if you think that you can, so if your requirement is 10 miles and 30 minutes, or 30 minutes, 10 miles, whatever the case may be, if you think that you can drive further in the time than the distance requirement, you want to use, the distance requirement. If you think vice versa, you want to use it the opposite way. So you can run the OD cost matrix using both of those accumulated variables in there. There's no real need to run them separately.
Okay, and if part of a hexagonal grid is within a drive time, how are members accounted for? In other words, is it only if the hexagonal centroid is within the drive time?
That's another great question. I should have actually mentioned that when I was doing it. The way that web app builder app was running is it was just simply generating a service area, looking at the hexagonal grid, and then counting up any hexagonal grid that intersected with the service area. But remember, and I didn't click completely through the step in desktop, is all the hex grid was a 1 square mile area that I then aggregated the patients up to. So that hex grid didn't actually have the actual locations in it. You could run the same type of analysis on the individual points and get the exact information, The point of that step through in that process was to share that data up in a generalized way that allowed data exploration by different members of your organization. But you could go in and use the point level data to determine how many were there. But in that particular example that I gave, if a hexagon intersected with the service area, it would essentially include all of those providers or all those members that were in that hexagon in the area.
Okay, and we have one other quick question. What is the best way to geocode incident locations on highways? For example, I-95 Florida mile marker 72.
I mean, if you're trying to geocode against mile markers, you really need some type of, like in South Carolina where I'm at, when I was working with the state, the DOT had a mile marker database that was combined with our street network database so that we could go against mile markers. But there's nothing in Street Map Premium or most commercially available data sets that are street networks or address points. Address points aren't going to help you for mile markers, but they're not going to help you do that. In that particular circumstance, what would be very nice is if the individual law enforcement agencies that are going out there and doing, responding to the accident are actually capturing the location in the field when they're doing that using whatever tools that are available. But geocoding against mile markers requires you to have those mile markers as a geographic indicator in your underlying street network database, and it would probably require a specialized locator too.
Okay, well, we've run out of time. If we didn't get to your question, we'll follow up with you directly after the webinar. Thank you all for joining us today.